I am Jill Holden. I'm a medical doctor here in Lake Forest for the past 28 years in OB/GYN, but I am the chief of the medical staff of Northwestern Medicine Lake Forest Hospital. So it's pretty amazing watching the team approach from administration to the specialists and the frontline workers all the way through the hospital on the changes that happen pretty rapidly. And um, I would say, the hospital brand new, bursting at its seams since March of 2018, but made with the foresight to flip any room into any other room, and very quickly had a surge plan in place for this impending change. So the 12-bed ICU became a 24-bed ICU, became a couple floors of COVID patients, with all the other areas being kind of held back that were non-essential. And it fluxed very quickly with the people that needed to be involved in making those changes. All the anticipation of what was happening in New York and in the state of Washington early on, a lot of communication between the specialists in the front lines gave us foresight in terms of how to prepare for that. So if you think about how medicine has changed over the last few years, and there's hospitalist medicine and there's medicine out in the community, and a lot of times, and especially in the field of internal medicine, somebody that has their internal medicine doctor as a patient would then go into the hospital, would hand over to the high acuity, complicated patients with the hospitalists. So we haven't had as many patients have hospital privileges. I mean, as many physicians have hospital privileges in the primary care arena, but with anticipating this change, so many people have been able to be brought through the credentials to have the surge, to have more of the internists throughout in the community that are now coming into the hospital to back up hospital-based medicine. It's actually working very, very well, and the system accommodated very, very well. You think about areas like surgery, very quickly we went to non-essential surgeries were canceled. And so that we would have ventilators available and PPE available, and really minimize the risk exposure to patients coming into the hospital that didn't need to come into the hospital, to decrease the risk for those working there, those patients that were there, but also for the patients not coming into the hospital. They were much safer there. But it's been a change that you've seen. Sometimes people that need to be in, that need to come into the emergency room, have been afraid to do that. So we've tried to be forthright with reaching out to patients that when they need to go in, it's a safe environment, but we're minimizing the number of people that go in. Same thing happens in all of the offices too. Really trying to get to the non-essential visits to stay out of the offices, and now kind of fluxing into telehealth to be able to meet the needs, to communicate and find out what the problems are and see who needs to come in and who doesn't need to come in.